your baby is dealing with gas pain and his or her stomach is distended and tight, that may mean that something else is going on that is not a normal finding that other babies typically deal with. This is where you want to be contacting your baby's pediatrician or taking your baby to be seen in the emergency room. Hello moms and dads, and welcome back to Nurse Onyi Teaches. My name is Onyi. If this is your first time here, you are most welcome. Make sure you look around at some of the other content that has been uploaded to the channel, as I believe that it will be of great value and use to you no matter where you find yourself in your pregnancy journey. Also, if you are interested in learning more about the topics that I do cover here, make sure you hit the subscribe button and turn on your notification bell, because that is how you are going to be made aware of every time a new video is uploaded. Now, as you can tell by the title, I'm going to be discussing some common conditions that newborns may encounter as they transition into the extrauterine or the outside world space once they are born. Before I jump into today's video, I just want to put a little disclaimer here. Make sure that you do not use the information in this video to diagnose yourself or your baby. Make sure that you are working very closely with a health provider or practitioner, or such as a doctor who knows about your baby's health history, so that when a plan of care is created, it addresses your child's specific needs or your specific needs, and the appropriate actions can be taken. Now, without further ado, let's get right in. So what exactly causes gas pain in babies? Well, if you think about it logically, once a baby is born, he or she is now responsible for every intake and output through their digestive tract in their bodies. Once babies are born, they are born with complete and well-formed digestive tracts. Unfortunately, fully developed and fully matured are two very different concepts. Babies have immature digestive tracts. So when they are breastfed or they are bottle fed, there's a chance that air can seep in when they're taking in their meals, and that air can become a problem later on in the digestive tract. Also, when a baby is crying or he or she is coughing or just breathing hard generally, there's a chance that air can escape from the trachea once it passes through the airway passage and go into the esophagus as opposed to the lungs. That air then flows like any other food straight through the stomach, through the intestines, and the baby's body must process it as it will any other meal. Unfortunately, air has the ability to cause things to become distended or stretches it beyond its boundaries. A distended belly causes some nerve endings to become very sensitive, and it doesn't just stop in the baby's belly. When that gas leaves the baby's gastric chamber or your baby's stomach and begins to travel into his or her intestines, whether it's the small intestine or the large intestine, that gas also causes those intestinal tracts to become distended. Those nerve endings and the different sensory organs within the digestive tract become irritated, and that can cause a lot of pain in your baby. Now, gas pain is not something that parents or caregivers should just take lightly when it's occurring in a baby. It's not generally a medical emergency, and I'll discuss that a little bit more later. But if your baby is dealing with gas pain, he or she may not want to eat as normal. He or she may cry uncontrollably, and then he or she may cry so forcefully that they further make the situation worse by breathing in more gas that further make the issue even worse. So you want to take care of gas pain as soon as possible. Now, some of the things that parents can do to help make sure that their baby limits how much gas that he or she takes in include: when you latch your baby to the breast, make sure that the latch is well sealed. Make sure that your baby's mouth is positioned correctly around the areola and your baby is not just latched thinly around your nipple. If you would like some more description on how to latch your baby properly, I have a video that's already up that you can go view to get a little bit more head knowledge on how to appropriately latch your baby. Also, when you make your baby's formula, make sure that you are using the right amount of water and the right amount of powder. And when you constitute or you shake the bottle up, make sure you give it a good shake so that all the formula mixes in evenly with the bottle. Now, when you shake formula, some formulas tend to foam. So when that happens, allow the bottle to sit for a little bit so that some of those gas bubbles can be broken apart and they don't just dump themselves into the baby's body, creating issues for your baby later on after the meal is completed. Another thing that parents can do to help their baby manage gas pain better, or even decrease the chances that your baby will experience gas pain, is to burp your baby during feedings. So when your baby is about halfway through with their food, whether you are breastfeeding or you are bottle feeding, you want to break your baby's suction from the bottle or the nipple of the the breast, and you want to gently burp your baby before you continue feeding the baby. What this does is allow your baby to release some gas bubbles that may have already been trapped from the earlier part of the meal, so that you don't have a stomach that is continuously expanding and distended to fit everything that your baby is taking in. When you are breastfeeding, you can do this while you between your breasts. So if you started out with the left breast, once your baby is done for about 10 to 15 minutes on that first breast, you want to burp him or her, and then you want to switch sides and continue to feeding. And then when your baby is done feeding, do not just lay your baby down. Make sure you burp your baby again, releasing as much air as possible to help your baby decrease the chances of dealing with gas pain later on. Now, I would like to put in here that gas pain can be normal. As your baby's digestive tract begins to mature, he or she will get a better hang of taking care of gas in his or her system. But until that happens, a lot of babies deal with it. One of the things your baby will do a lot during those first few months and truly throughout his or her life is pass a lot of gas, or also known as farting. This is absolutely normal, and it's actually showing you that your baby's digestive tract is clearing out gas effectively. If your baby is having issues with clearing gas effectively, even after you've done the burping part and making sure that you prop your baby up once he or she has had a meal, then other things you can do include tummy time for your baby. So tummy time is a gentle activity that parents can do, and all it is you take your child and you lay your baby down on his or her stomach. Make sure you do this while somebody is directly observing your baby, especially if it's a newer baby who cannot effectively control his or her head, just to reduce the chances of your baby suffocating trying to move around. So when your baby is laying on his or her stomach, you just want to gently pat your baby or talk with your baby. That movement that your baby does, a lot of babies do a little swimming activity when they're on their stomach, helps to break up the gas bubbles and allow your baby to effectively pass it out of their digestive tract. Another thing you can do is, with your baby lying on his or her back, you can gently use your baby's legs and ride what is known as a bicycle. That alternating movement of your baby's leg helps to get things moving along in their intestinal tract. Or if your baby is hurting enough, he or she will even pull their leg up to help with the expelling of gas from their digestive tract. And that movement that I previously suggested, and we call it bicycling your baby's leg, can help to get the gas expelled from your baby's digestive tract and get him or her settled down. Another thing you can do is you can get a bottle of warm water. Warm, not hot. You take this bottle of warm water and make sure you test it against skin that is not around your palm, because your palms are not as sensitive as the skin, say, inside of your elbow or just regular skin. Don't use skin that has a different texture to it. You want to make sure that it is warm water, and you can gently roll a bottle of water across your baby's belly. The heat that is supplied from that warm water can accelerate gas bubbles and help to also break them down, and that will help your baby to effectively push, or at least break it down, and help them pass it out of their body. Now, if your baby is dealing with gas pain and his or her stomach is distended and tight, that may mean that something else is going on that is not a normal finding that other babies typically deal with. This is where you want to be contacting your baby's pediatrician or taking your baby to be seen in the emergency room. If your baby cannot pass gas, he or she is having a fit, does not want to eat, and their abdomen is absolutely distended, then it's time for parents to take a little bit more step proactively to make sure that their baby's digestive tract is not dealing with something else, and that you just want to play it safe rather than take any chances with your baby's health. So go get that checked out, and if it's just gas, your provider may give you things or tips that may help you relieve your baby's gas. Another thing that parents can do, if you've tried all of these natural remedies and none of it work effectively for your baby, is you can get gas drops. Here we have a brand called Mylicon, and I will insert an image here somewhere. What you can do with Mylicon is you give your baby just a couple drops of it, and Mylicon works much the same as Gas X in an adult's body. It breaks down those air bubbles and helps your baby. Smaller gas bubbles are easier to pass out as opposed to a large one that's causing the intestine to pull and retch, and that can reduce the pain that your child experiences and also reduce the size of the gas bubble and help your baby get it out of his or her system. Another condition that is frequently seen in a lot of newborns is something known as an umbilical hernia. When a mom is pregnant, her baby depends on her to filter waste out of his or her body and bring nutrition through the umbilical cord. Now, once your baby is born, his or her umbilical cord is clamped and cut. And once that cut is in place, your baby's umbilical ring should heal tight and that stump will fall off. Well, for a lot of babies, and especially African American babies, that stump, that ring does not heal very tight, and it causes some of the intestines to bulge out and sort of protrude where it's visible. Now, for a lot of babies, that umbilical protrusion can be easily reduced, and I'll expound on it more later. But one of the main focuses of the umbilical hernia is that it does not cause the child any pain and that it is not so big that it requires surgical intervention. A lot of children, theirs will naturally close by the time they are 5 years old. If your baby continues to stay protruded or it can be visibly seen, then you may want to talk to your baby's pediatrician so that they can see if surgery is an option for your baby. What you want to do though with your newborn is make sure that this umbilical protrusion can be pushed back easily and that your baby is not showing any signs of discomfort from you doing this activity. So with your baby lying on his or her back, you want to take your hand and gently press on that protrusion. And what you want to see is all the content from your baby's belly button easily go right back into their stomach or their digestive tract. If you meet resistance, stop pressing. Do not put any additional pressure on any protrusion that meets resistance from your hand. At that point, you want to take your baby to go be seen. If the area appears red or swollen or hard, or your baby is crying uncontrollably, you want to get that addressed. Now, speaking of crying, when your child is crying, their umbilical hernia may bulge because their abdominal pressure is increased. This does not mean that your baby is going through any kind of adverse outcome, but you also want to make sure that you look at it to make sure that if you press on it, it goes in very smoothly. I've had 4 children and all 4 of my children were born with this umbilical hernia, and as of date, all of their umbilical hernias have easily resolved and with no issue at all. Now, some of the things you can do, like I said, is just make sure you reduce it very carefully. And as your baby grows, he or she may feel a little somehow that their belly button is sticking out and that their friends are nice and flat. You just want to encourage your child that it's okay and that they're fine and that their doctor says that they are okay. Some of the things you do not want to do include taking like a band and grabbing and tying it off in the quest to help it. Why you don't want to do this is because if you grab that and in a segment of your baby's intestine is in that umbilical pouch, you may tie off your baby's digestive tract and you can cause your baby to have more adverse outcomes than if you just leave it alone. You also want to avoid taping anything like a quarter to it to try to keep it in place. These practices are based on old wives' tale and they are not really effective. Instead, they can even prove to be harmful to your baby. Now, like I said, if your child is crying and this area is red or swollen or it is hard to the touch, you want to make sure that you get it addressed with your baby's pediatrician as soon as possible. Thank you for viewing this video. If you have learned something from the content of this video, do not fail to like it. Also, if you know somebody who can benefit from it, make sure you share it with them. And then hit the subscribe button and turn on your notification bell so that you are also part of this growing community of empowered learners who are active participants in their own healthcare journey. I wish you excellent parenting, and until the next time, be blessed.